Hi, everybody. I think we're live. I'm Debbie Bisno, and I am the resident producer of McCarter Theatre Center. And I'm so thrilled to be here tonight. And thank you all for being with us. I know you can't see everybody other than our panelists, but we do have a big crowd of registrants, and we're really, really excited to have you. May is Mental Health Awareness Month, and I wanted to just say before we get started kind of how this came to be. And the impetus for this came in March as we neared the 1-year anniversary of lockdown and the heaviness of that moment. And just on the heels of the release of McCarter's virtual theater project, the Manic Monologues, which we'll get into in just a moment, the Princeton Public Library invited us to partner on Mental Health Awareness Month with an event. And we thought using the Manic Monologues, which we created in partnership with Princeton University Health Services, would be an ideal jumping off point for a meaningful conversation about mental health, checking in on where people are in their current wellness journeys and where we can all access resources. So that's the why of what this is all about. I want to first thank Janie at the library and Paula from McCarter for making this happen. A lot of stuff goes on behind the scenes for a webinar, and I'm thrilled to have this terrific panel here tonight. I'm going to let them introduce themselves, and just to say that it was the Manic Monologues and the launch of this project during COVID that I became connected to Calvin and Dr. Chin, Dr. Ross, and Dr. Carlos. And so it's sort of fortuitous. And I always say that COVID has been awful, but it's also had many silver wanings. And you three are some of those silver linings. So I'm going to let you introduce yourself, and we'll start off with Kimme, because alphabetical order, we'll go with you first.
Well, thank you so much. And especially thank you to McCarter Theater and Princeton Public Library for this opportunity to be here, and a special thank you for the opportunity to sit on the panel with Dr. Chin and Dr. Ross. I am indeed not a doctor. I am Kimme Carlos of Kimme Carlos Motivational Consulting. So I'm a mental and emotional wellness advocate. I'm a life coach, a facilitator, and I teach on the intersection between wellness and social justice. So a lot of work around what wellness looks like physically, mentally, emotionally, especially in communities of color, and how those intersect with social justice, specifically systemic racism and inequities. And so I'm always delighted to have an opportunity to have a discussion around mental and emotional wellness, especially during the month of mental health awareness.
Great. And I just want to say I called you doctor incorrectly, but I consider you a doctor because you're a fixer and you help and you make us well. So I'm going to...
I consider that prophecy, so thank you.
Yeah, I'll give you that attribute. We'll go to Dr. Chin.
Hi, my name is Calvin Chin. I am also just so delighted to be part of the panel today. It's been such a pleasure to be able to collaborate on the Manic Monologues with Debbie and with the McCarter. I think it's a fantastic project, as you will soon see, and it's so exciting, just all of the different ways that we can share the project to the masses to encourage people to take a look. And so I'm delighted that you all are coming to this panel and have a chance to sort of take a look at the platform if you haven't already. I'm also just very happy to be part of this distinguished panel with Kimme and Whitney. My role is as the director of the counseling service at Princeton University. And I've been there since about 2013. And I've worked in college mental health all my life. I'm delighted to be with you and look forward to the conversation.
Great, thank you. And Dr. Ross.
Thank you, Debbie. It's a pleasure to be here. My name is Whitney Ross, and I'm the executive director of Trinity Counseling Service. And these kinds of partnerships are so terrific, and the opportunity to talk about mental health and wellness with different partners in the community is something that we so enjoy doing. So I'm grateful to have this opportunity tonight and to work with Calvin and Kimme and all of you. Prior to becoming the executive director of Trinity Counseling Service, I worked in private practice in Princeton, working with a lot of Princeton students and graduate students and students of younger students in public and private schools, and have some executive coaching and organizational background, and look forward to having a rich and wonderful discussion this evening. So thanks so much.
Great. Thank you all. Let's go now. We're going to do we're going to pivot to the Manic Monologues. We're going to show you a very short trailer so you get a sense of the piece. And if we could roll tape on that.
Mental illness can be devastating. But with openness, acceptance, and hope, we can change the conversation by having a conversation.
For me, this self-hating, I guess another way of saying it is, being a friend means everything.
Thank you so much. Thank you so much, Corey, for playing that again. Actually, it makes me appreciate our sound designer and original composer that much more. So how different it is. But just watching it made me think about wanting to share with you that we created this. We had planned to do this as a one-night staged reading. It's a play. It started off as a play, and we were going to do an evening. And because COVID hit and halted live events, we said, why don't we do this as a digital project? And what ended up becoming something that would maybe reach 1,000 people if those people could find parking, is what I always say, at McCarter or on campus, became something that has already been seen by over 6,000 people in many different countries and will be accessible for 5 years. And those again are the silver linings. So it really was something we didn't know would turn into what it turned into. So what I'd like to do now is take you on a very quick site tour. We're going to start off with one of the monologues just so you can see how they're filmed. And I wanted to point out that those little the mobile figures, each one of those is a separate monologue, and each one of those monologues is a true story of somebody's true story that was submitted, that became part of the Manic Monologues. And these are professional actors performing those stories. And so the pieces can be viewed at your own pace. You don't have to watch them in succession. You can go back to the site anytime. You can spend 5 hours, you can spend 5 minutes. But we're just going to play one of those, and then I'll give you a really quick site tour.
Since early childhood, but within the past past 2 years, I put a lot of work into my cognitive behavioral therapy. I have OCD, and the pandemic has certainly taken a significant toll on my treatment and recovery. I've had OCD since early childhood, but within the past 2 years, I've put in a lot of work to my cognitive behavioral therapy, and I'm happy to say that I've vastly improved. I used to routinely wash my hands until they bled, but I've stopped that behavior along with many other compulsions. Part of my exposure to therapy involved not carrying around hand sanitizer everywhere I went, occasionally eating food without washing my hands first. Of course, given the current circumstances, those kinds of exposure are no longer possible. It's demoralizing to feel like I'm backtracking in my progress, even in cases when my response is consistent with the new baseline and technically not an OCD response. My OCD type symptoms are cognitively linked, though, so washing my hands more frequently, however normal that may be given the circumstances, has sadly rekindled my other obsessions, compulsions I had previously eradicated. My OCD is actually not particularly cleanliness-based, but rather more guilt-driven. I often get wrapped up in magical thinking where I feel like I'm personally responsible for all the bad things happening in the world, even when there's absolutely no logical connection between myself and the external events. For instance, I'm terrified of not properly sanitizing things and as a result infecting other people. It's gotten to the point where just leaving my apartment to get my mail or take out the garbage has become excruciatingly terrifying. A trip to the mailroom requires 30 minutes to an hour of sanitization and makes it impossible for me to be productive for several hours due to what I like to call a radius of anxiety around the stressful event. And then there's the secondary layer of guilt in feeling bad that I feel bad because I know I'm extremely lucky. I'm healthy. My family is healthy. I have the privilege to work from home with pay. I have secure housing, etc. So I'm trying to be patient with myself. I'm very thankful for the free teletherapy currently available through the Student Health Plan and for my wonderful network of supportive family and friends. I was able to overcome OCD before, and I'm certain I'll be able to do it again.
So I'm going to take you on a little tour here now. If you just look at the, this is our sort of what we call our main page. And as I said, all of those figures lead to other monologues. And the other thing that you didn't get to see with the end of this monologue was a postscript. And each of these monologues, or most of the monologues, I think 90% of them have a postscript, which is what they're doing now, what these real people are doing now. And when the original creators of the Manic Monologues, Zach Burton and Elisa Hoffmeister from Stanford, did a call for stories, some of them were anonymous, some of them were people shared personally, but they also have kept in touch with some of these people. And one of the things that we wanted to highlight in doing the Manic Monologues was that these are stories of resilience as well as challenge. And so we wanted to make this piece about wellness and resilience and hope. And I think that if and when you go and watch these stories, they will range from everything from this young person's story to a very wide range of different stories. So I encourage you to check out those at your leisure. So if you scroll a little bit to the side instead of up and down, that's one thing we found fun on this, creating this, is there you can play around with this radio and listen to your heartbeat. You can play music with your experience. This is a stack of books, and if you click on that stack of books, you'll go to a long list of curated books that we did a deep dive into research, also with the help of Princeton University and the health services and all of our other partners in trying to find books that range on a lot of topics. So that's a wealth of knowledge. If you go back out and you go to our conversations and interviews, you might recognize this gentleman there who these are a list of panels that each one is a talk. That's me, and that is Zach Burton, who is the original creator of the Manic Monologues. This is Calvin. Calvin was very excited when he was talking to Jean Twenge, who is a best-selling author and psychologist. And there is Kimme Carlos and Vivian Guevara, and they talked about mental health and social justice. So it's a range of topics here. There was mental health and COVID, and there was also mental health and social media. And then there was a student mental health panel, and all of these are very interesting. They're short. I recommend that you check them out, and really gives a wide perspective. And there are bios on all of our panelists, scrolling down, and we can go out of there and go to our bulletin board here of resources. This resource board, there is a script if you wanted to read the script. There are stickies up here that go to, why don't you do the help and hotlines first? So this is a resource page where you can do another deep dive. And if you scroll down the page, you'll sort of see how the stickies relate to this larger page that we curated. You can get to this through any of the stickies, but these are advocacy links. Each one of these goes to another link. And there are talks, and there are a myriad of resources. Okay, you can go out of that. And I'd like you to hit the Student Center sticky. In particular, this was something that we worked on with our student partners and with Calvin and the University Health Services, both for the Princeton University students, but also students at large. So if you go scroll down a little more, there are, one of the things that we found through this project was that there are so many young people that are becoming advocates for mental health. And that is so different than how it was when I was in college or I was in high school. It just wasn't talked about. And it's so, I think, gratifying, inspirational, and hopeful to feel that young people are comfortable, or more people are comfortable talking about this. We can go back out. We can go now to the fun. There's a creators and credits page where you can read everybody's bio that worked on the piece. There are director, our designers, our web coder, our sound designer. There's me and my dog. She's my wellness coach. There's our stage manager. You can then see our marketing folks. You can read about all the cast. And yes, okay, we can go out of there. And another very fun part is our Etch-a-Sketch. And this is where you can sort of have fun, write your own story, be playful, and shake it out, as the sticky says. And that's the site. So that is the Manic Monologues, and we are really, really happy with what this became, and it's was a huge undertaking and something we'd all never really done before. But I appreciate all the work that went into it with our panelists and our partners, and I also want to mention that the Princeton Public Library, Janie can talk about this a little bit at the end, but has a book list that they have curated on mental health, and she will share that link. We'll share that link in the chat. So I think we're at the point now where we want to talk about resources, and we want to talk about what's really going on for people. And we have amazing human resources right here with our panelists, and their mental health and wellness human resources in our local community. And that's Calvin, Whitney, and Kimme. And so I'm going to start the discussion here, and I would like to encourage any of our attendees to, engage with us in the chat. Some of you already sent questions. So I'm going to start with a question about, somebody said in the monologue, I'm feeling bad that I'm feeling bad. And I think a lot of people have this feeling, whether it's, OCD, or whether it's just a general human, feeling right now. I thought that was kind of an interesting gateway. And I wanted to ask each of you sort of, how do we prepare to enter into the new world or the new way of being with so many different, it's just, how are we re-entering and centering ourselves? And from each of your perspectives, there was a question from a student saying, how do we prepare, or a question from a faculty member or a teacher saying, how do we prepare students for re-entry into in-person instruction? And how do we re-enter the workplace? How do we re-enter family life? And so I'd like to start with you, Whitney, just in terms of people you're seeing, and how do we re-enter, and what are you seeing people struggling with? And how do we navigate it?
Right. Well, thanks, Debbie. And first of all, I'm so glad you walked us through that, because I have navigated it, and I realized I only navigated a small portion of it. So I'm going to go back and walk through it. And the more we watch and listen and talk about aspects of mental health, the better we all are. And that's what we need to continue to do. And to speak to your question, we, in the mental health field, I think we'd be surprised, and we are surprised, if people aren't talking about feeling anxious or sad about something today. There's a lot to be anxious about. There's a lot going on, right? A lot has changed. And it's a matter of degree. We saw in the monologue that we saw today, obviously, that young man, his functioning is pretty impaired. And that, to me, is kind of the definition. We want to be careful about pathologizing in general, but certainly now, when there's so much going on, people are anxious or sad, but it's on a continuum. So our functioning being impaired is what we want to look at when we're really starting to worry about people. In terms of re-entry for a 5-year-old going to kindergarten is quite different than an 18-year-old starting in college, or those of us re-entering the workplace. So how we're thinking about those things from a developmental standpoint is very different, although to some extent there are some commonalities, and thinking about structure and putting some structure in place for all of us, again, I think can be very useful and can help decrease some anxiety in general as we think about going back, whatever that means. So thinking about routines, a breakfast, a lunch, and a dinner at whatever time those are, and starting to talk about it. Having breakfast, lunch, and dinner, and thinking about what that might look like if it's September, we're 4 months out. So starting to plan and think through what some of those things are. And structure is a scaffolding, and it can be very organizing for people, but it's going to look different for everybody, and having grace and patience for ourselves and for others, given that it looks different for different people, different families, different age ranges, is also very important.
Yeah, it's interesting that you say structure, because it's sort of like the one thing that we give babies right when they're born, and what we give pets and what we give, it's like, but somehow human beings end up like, it's hard to get back to structure, but it's the thing that like grounds us. And I wonder, Kimme, in terms of re-entry, and what are some of the ways people or you're sharing or you're hearing that to mentally prepare for the transition back to normal? And does structure play a role, or
Right.
what's your lens?
Let me first echo Whitney that the website is powerful. And it's going to be a really, will continue to be, because you said it's already hit 6,000 people, continue to be a really powerful tool in our community. So again, thank you for all the work that went into that. It's fascinating because I feel like as an advocate and a public speaker, I feel like I kind of straddle two worlds, right? My day job is I'm a director of operations for a small nonprofit in Princeton. So we have the privilege of our small but mighty team being able to work remotely, and everybody is safe in their homes. And so with the team, we are looking at how do we come back into a new sense of normalcy when we all come back to the office, right? But then also a large part of the work that I do in the intersection of mental health and social justice is with our essential workers, right? Who never left. Who didn't have the opportunity to work remotely. So they never left being in public, right? And they're dealing with so many other challenges that are bringing about traumas, like whole families that, got COVID-19, whole families that are struggling with substance use or depression and anxiety and hypervigilance, because of isolation, and a whole host of other social injustices that really got compounded when the pandemic hit, right? And so a lot of what we are going to start seeing in this new normal, because we're not going to go back to the world that we knew ever, right? So this new normal, as we step back out into the world and start relearning how to engage socially again, and we all have to put on real pants and not yoga pants, right? What we're going to start seeing, unfortunately, and I'm sure both of the doctors in the room, already know this, is the trauma is going to start coming out, right? All that trauma has been isolated. Now people are going to come back into the world, and that trauma is going to be a lot more open. And a lot of us are feeling bad about feeling bad because we're dealing with a level of moral injury. We're dealing with a level of survivor's guilt, I know for me personally, I feel extremely guilty that have been so privileged for the last 14 months to work remotely, but working, really closely as an advocate with communities that have literally just been decimated, not just by COVID, but all of the mental health crisis that come out of that, right? And the increased substance use disorder that comes out of that. So I think, there is no more normal. We're not going back to what we knew. There's some small blessings that have come out of it, right? We've realized now that we can work remotely, which means less traffic, which means parents are not going to have this bigger struggle with childcare, and a whole host of blessings that have come out of it. But we have to really wrap our heads around, in this new normal, how are we going to empower those who are really, really struggling with their mental health because of a lot of the injustices that were already there, and because the isolation and the hypervigilance of the pandemic has compounded mental health challenges that were already there. And so, returning is really going to be a community effort, making sure that people are empowered with the resources that they need, and pointing them to, powerful professionals like Dr. Chen and Dr. Ross, to make sure that people are plugged in, and get the supports that they need.
Yeah, I mean, it would be great if resources and support could be part of the structure. It's like that is part of the scaffolding, right, for everybody in this new time. And by the way, I just want to say that I'm going to advocate for Yoga Pant Friday. Dr. Chin, let's talk about you and your world, which is, students and students at a very vulnerable age. I mean, kids are, every age is vulnerable, we know, but this is pivotal time too, right? College and re-entry for you and your arena.
Yeah, I mean, I just want to echo what Whitney and Kimme said, and please call me Calvin.
Okay.
About sort of like, especially the idea of like giving grace. I mean, I think the thing that I've been sort of saying over and over again, like in the different groups that I speak to at the university, is that it's universal, like what the students are going through is exactly what we're going through. It's been incredible, right? Like that there has been this sort of world-changing event that we've all sort of had to endure for like 14 months running, right? I mean, like there's some hopefulness now. I'm feeling certainly more hopeful than I have in a while, but um, I think that we all just have to give ourselves the grace to know that it's going to take time to sort of readjust or to adjust, right? I agree completely with what Kimme said. I don't think that we are going to go back to the way things were before this happened. I think things have been permanently shifted in a fundamental way. I think things are going to be better, but I think that we just have to give ourselves permission to need that time to sort of adjust to sort of what the new normal will be, without a lot of that judgment, right? I mean, I'm reflecting back on the lovely video that you highlighted, and the struggle that the actor was talking about around sort of not being so hard on themselves. And I think we all should sort of give ourselves permission to not be so hard on ourselves, right? This is tough. The other thing too that I think will happen is all of us kind of being able to grieve, like what this past year and a half has meant. And I know that like for some of us it's grieving loved ones who we've lost, right? But for all of us, we've lost normalcy. We've lost um, moments in our lives that were special and that were important, right? We've lost the connections that we had and that we used to sort of make our lives rich, before this, right? Um, and I think that we need to grieve, I'm looking forward to a time when we can all just sort of like, because I think right now we're all just sort of like still coping, right? Like we're in the middle of it. We're trying to keep it going. We're trying to, get the kids homeschooled, pay the bills, you know, make enough money, keep ourselves together enough to show up every day. And at some point when things resolve and calm down, I think that's when we can like take stock and take a breath and I think honestly grieve like what we've all lost, universally, and I think that moment is going to be really important. And I really hope that we can take the time to honor it, right? And not gloss over it and not just move past it, but honor what we've all experienced, universally, and mark it in some way.
Yeah, I feel hopeful that we will, because I feel like there are enough people that, you can't sweep it under, and it's sort of like, and this gets to mental health being what I say, out of the closet. Like, I don't feel like I mean, people, there are a lot of communities that, and families, and many people that aren't comfortable talking about it, but there are a lot of people talking about it, and a lot of workplaces prioritizing it, and a lot of families being able to say, yes, um, and so I'm hopeful in that sense. And I also think that I'm curious to know what you all think about social media almost working against, it's like working against all that we're talking about in terms of stabilize, in terms of, part of feeling bad about feeling bad is that you think everybody else is feeling good and that you should be okay, right? And I think, how could social media not, do that? And also, how much do our devices how much do our devices that we multitask on all the time, and how much even Zoom, and the Zoom fatigue people talk about, how are you seeing that in whatever way, whether it's making people feel insecure, or whether it's just sucking up a lot of time? Are you seeing that manifest with the people you know, advise or counsel or interact with?
No, I want to go back to something Calvin said about the grief part, right? And how huge that is right now, because people are not only obviously grieving, the loss of loved ones, who may have died from the pandemic, but people are grieving like their loss of normalcy. I've had so many people come to me that are literally in a state of grief because they had real, tangible, concrete plans for 2020 that literally just poof, went up in smoke, and people were going to relocate, and they were going to buy houses, and were going to have weddings, and, children were going off to college. And so there's a real sense of grief there, but there's also a sense of, I think, to your point, Calvin, a sense of collective grief, in that for many of us, we are beginning to realize that this country is not what we thought it was. When we realized that there was absolutely no safety net for those who were on the bottom of the socioeconomic level. And so we are literally grieving the loss of the way we viewed this country and the way we viewed life, because we're seeing these tragedies and these traumas unfold literally on the world stage, right? And so there's a huge sense of grief, collectively and individually, personally, that we're dealing with, that, again, I agree, once we do kind of all come back into the public world, and different states are doing that at different levels, that's when we're really going to start to see how it has affected everybody. And I also agree that social media and the media in general doesn't do a really good job, right? It's this facade that everything is okay. At the end of the day, I allow myself like an hour to sit on the couch and be a zombie, and I get a kick out of commercials. But some of the commercials, I'm thinking, this is ridiculous that anybody could be this happy right now, because it's, and even on social media, I'm seeing the way people portray themselves, and knowing that this is not real. And so again, it goes back to, our gentleman who's talked about feeling bad about feeling bad, because in this country, pull yourself up by your bootstraps, and why are you crying? And, put on a happy face. And that's impossible to do. But social media kind of guilts us into thinking that if you're not dead, then you should be grateful, right? And that compounds, the hypervigilance and anxiety, I think, that people already have.
Yeah. Whitney, did you want to add to any? I think the grief conversation is certainly again, I'm hopeful that it's not going to be ignored, that it's not going to be shut down, and it's too strong to be so, right? And
Yeah. You're exactly right, and everything that's been said. When I hear grief and think about grief, I think about it on so many levels, and certainly people have lost people and jobs and ways of life. And I think about, the two most common mental health struggles in our country right now are anxiety and depression. But what really is driving anxiety and depression, and what do those mean for different people, and what's underlying them? And when we start talking about social media, I start feeling bombarded by sensory overload. And I think part of the anxiety about going back to wherever we're going, whether it's work or school or wherever we're going, has a lot to do with overstimulation and loss of what you were saying, Kimme, what we thought we were doing before, and our concept of what we thought things looked like before. And for me, I've been spending a lot of time thinking about this. And I think, Calvin, part of what you were talking about was it's disconnection. And I think we've been disconnected from, frankly, ourselves for so long, and we've been racing and running and pushing ourselves, and a lot of that's driven by social media and competition and faster, and not stopping and thinking about where we're going or why we're doing this and why we're pushing each other and ourselves. And it's gotten the anger, and that's part of the overstimulation, and it's not good.
Yeah.
I mean,
Yeah.
Newsflash,
Yeah.
Right.
Yeah,
Bottom line is it's not good.
No, the social media that I'm watching are puppy videos. I've got my dog here.
Me
I don't know
too.
if you can hear this. I'm worried she's going to throw up because I'm giving her all of these treats to keep her quiet. But anyway, that's just an aside.
Oh gosh, that's
But
great.
one thing that I'm hopeful about is that the pausing, it's caused us, for better or worse, there have been a lot of losses and not being able to do things, but it's forced us to stop. It's forced us to stop and pause. And at some point we can talk about mindfulness and meditation and some of the treatment benefits of that can be very useful, and how we can use that therapeutically.
Yeah, and I want to get there tonight because there's some very specific questions related to how and what advice you all have. I heard something 2 days ago from a friend who was grieving, and she said somebody told her that without tears, there's no soul in the rainbow. And I thought, that is, or there's no rainbow in the soul. Sorry. Without tears, there's no rainbow in the soul. And I thought that is exactly right, is that you have to allow yourself to grieve in order to, find the grace and to come through. And I feel like we have to, do that pause. We have to honor the pause. We have to say, no to the barrage of social media, or whatever it is. We all have to somehow make that part of the structure, make that part of the daily, ritual, or you have to reach for that, because if you don't let yourself go through that journey, it's there, it's going to come out somehow. So somebody asked in the chat, which in one of the questions about loneliness, and I wanted to just bring that up. And ask you, is somebody said, loneliness is the most severe stress, or one of the most severe stresses on people with psychological disorders. And where do they go for help? I mean, here we have this massive resource guide, right? But if you're in distress or you're in crisis, like I know, in the past when I was in college, I just didn't know what to do first, right? And somebody says, well, you need to see a therapist. And you go, I don't even know where to start. And that's daunting, right? And so, let me start with you, Calvin, and say, what do you say? What's the first step?
I mean, I think that loneliness is so tough, and I think has been exacerbated as a result of the pandemic. I think that, you can become sort of acutely aware of of how many people you're seeing, right, in a day, and sometimes not seeing anyone in a day, right? I mean, like the shutting down of, like, you can't go to the theater, you can't go to the movies, you can't go to a performance, and just not being around people like in a coffee shop, I think just highlights that for people. And so I think that, my tact always with people who to describe feeling lonely is, um, to sort of really think about it in terms of small steps, right? Like, well, what are some ways to sort of like really take an inventory about, the people that actually could be in your life that you might reach out to, right? Because some of the things that happens is that, you may start to believe that, oh, well, this person really doesn't really care about me, or doesn't really want to hear from me, or this person has too much going on in their life, and so, they don't have time to sort of get on the phone or have a conversation, or this person doesn't really care because they haven't called me in so long. And I think part of getting out of that mindset is by thinking through, well, maybe there is someone, right, actually in your life that you could reach out to. And sometimes it takes that. It takes that sort of initiative to, like, what would it be like to just call randomly out of the blue? Like, what would it be like to just try to reconnect with, someone that you went to college with years ago, and that you've just been thinking about. And I think one of the things that I think has been nice that I've heard some people experience during this pandemic is reaching out to random people, and having that be met with so much excitement and enthusiasm, because people, I think, are starving for that kind of connection. And so if you can take a chance, sometimes you might be pleasantly surprised by, who might be on the other end of that phone call or text chain, who really does want to engage with you.
There was so many people that reached out to me um, when the pandemic first started. So like around, March, April, May, when we started having this realization that this was not going to be over in 60 days, asking exactly that, like, what do I do? I feel so isolated, and one of the things I learned is that, extroverts like myself, we thrive on that energy, being in a coffee shop or being in the theater or, at the mall or having a lot of people around us. But everybody, whether you're an extrovert or an introvert, needs that connection, right? We need to feel deeply connected to other people. And that's the hard part when you're in lockdown like this, right? When you're in isolation. That's why, there's whole grassroots movements that fight against like solitary confinement in prisons, because that's torture worse than death, because you're removing that engagement with other people, right? So that really brings an oppressive sense of loneliness. And so one of the few blessings I think that came out of the pandemic was learning how to do things remotely. And so I've been encouraging people wherever I can to make the connection, whether it's through social media, or if it's on Zoom, or like Calvin said, making phone calls to people that you don't normally call as often. I think I've spoken to my 5 siblings more in the last 14 months than I have in the 30 years that we've all been adults and left home, right? And my adult daughter, who, I'm blessed to have her as like one of my best friends, has suddenly started calling me like every single day, and I'm talking to cousins that I haven't spoken to in years. And I have colleagues calling me out of the blue saying, hey, how are you doing? For the first time since the pandemic, I went to the farmer's market on 206, and I was just so excited to see so many people. I wanted to run around and hug everybody, so, and I'm sure they would have thought it was weird that this woman, was running around hugging strangers, but, loneliness is so oppressive. And so when I teach about mental health, I really make sure that people understand that there are ways that you can be proactive about staying connected, because that is exactly what anxiety and depression does. It tricks you into thinking that there's nothing outside of your own head. And then you just stay stuck there because no one wants to listen to me. No one wants to hear my problems. Nobody's going through what I'm going through. And that just compounds it, right? So we have to be real strategic and proactive about making sure we stay connected the best we can, you know, so that we don't kind of fall into that black hole of depression and anxiety, you know. So I think that's a really great point for people to understand is how detrimental loneliness is on a good day, but especially in the midst of a pandemic, you know.
Yeah, and it doesn't have to be, oh, reach out to your high school, you know, boyfriend or you know, but
Unless you want to.
but it could look like anything. I mean, whatever your connection points are, right? Whether it's a sibling or a neighbor or, you know, a colleague, I mean, it's different for everybody, I imagine. Whitney, did you have some?
Yeah, you know, I wanted to say one other thing too, and I think those are fabulous points, and they're great strategies for continuing, and I hope people will continue to stay in touch in this way. I also think it's important to normalize the difference between loneliness and being alone. They're different. And a lot of people actually like to be alone and don't feel lonely. And I fall into that category. I actually am very happy being alone a lot of the time. And there are people who I've talked with a lot of people who are anxious about and are a little bit sad and are talking about mourning the fact that they need to go back to work because they've actually really enjoyed this time. Don't worry, colleagues of mine who are on this chat and board members, if you're listening and whatever, I will go back to work. But there's part of me that's going to mourn the fact that I've been perfectly fine during times of this time and being alone. And, you know, that's actually, you know, something too. The developmental order of things really shifted. It was hard. Kids who were supposed to go off to college, parents who were supposed to be empty nesters, suddenly, you know, had kids back home who were supposed to be alone and were looking forward to that time. Things shifted, and there may be people who are looking forward to, you know, that shift also. So the difference I'm thinking between being alone and being lonely is something to play with and think about, and how that's different.
Yeah, and I think we're also talking, the common denominator is transition in general, right? And transitions in the theater are always, like, we call them they have to be right? There's transitions between scenes, and that's so important. And I think transitions in life are really hard. They're just always hard, right? Because change is really hard. Somebody asked a really, all the questions are good, and I wish we could get to everything, but when should a parent take a child to see a therapist? My child seems to be showing signs of a kind of depression called temporary depression. I don't know if that's a thing. That's new to me, or maybe that's this person's term. And I guess we can open it up aside from a kid, but when should somebody see a therapist and feel, you know, is it, what are you, let's, Whitney, why don't you start, since.
Sure, I'm happy to. Whether it's, I'm guessing that they're talking about, you know, temporary or a situational depression or situational anxiety, which this would certainly, you know, hopefully people are, you know, I'm guessing people are more anxious, or there may be more sadness now. And typically we would think about, is it interfering with your life? People get sad, people get anxious, but like the actor said in the monologue, it's taking him half an hour or an hour to get to the mailroom. That is hugely problematic. But there are some people who are anxious but can get through their day and it doesn't interfere with their life. I think there are other resources. There are pediatricians, there are school counselors who see children during the day. Is the child functioning during the day at school? Are grades fine? But the parents worried about the child at home. It's really, it's a judgment call often. But if it's interfering with the child's functioning and he or she can't get to school or grades have dropped, friends have changed, then you may want to think about it. That's how I think about it.
Yeah. And Kimme, is that the barometer, sort of the litmus of is it the interference?
Yes, exactly. So I actually teach at the national course, mental health first aid, and there's a youth mental health first aid because it's so hard to kind of distinguish between, is this normal adolescent behavior or is this, going into a crisis? And so youth mental health first aid teaches exactly that. It teaches, parents and caregivers and pretty much anyone who engages with youth, whether it's educators or pediatricians or, coaches or whatever, how to recognize, when a child is going into crisis. And so obviously, Whitney hit the nail on the head when it begins to impede this child's normal way of life, right? So it's not uncommon for adolescents to suddenly back off and not want to spend a whole bunch of time with their parents. But when they start cutting off from everybody and they're not coming out of their room and they're not showering anymore and they're not eating or they're losing weight, or you're seeing a lot more anger, or when there's obvious red flags, then yes, you want to definitely sit up and pay attention to that and seek professional help to make sure, that this youth is getting the support that they need. And again, that's on a good day, and social media plays a lot into, our youth struggling nowadays, especially, like cyberbullying. But take all of that our youth are dealing with and then just plop a pandemic and remote learning, in the midst of it. And we have a lot of youth that are struggling right now. So yes, as a parent, you really want to familiarize yourself with what do red flags look like? And should I definitely get this child in front of a professional?
Yeah. And Calvin, is it common or different or the same in the college setting, or is or is it because college is a pressure, there's sort of like inherent pressure, especially at an Ivy League institution, or I'm sure there's college pressure everywhere, but also it's a pretty intense place, right? And so are students questioning whether they should see a therapist? Is it everybody's in the health system now and it wasn't like that? Like what's happening over at your campus right now?
Yeah, well, because I work at a counseling service, and our services fortunately are free. We try to lower the bar for entry. And so we encourage students who are even just curious, right? Wanting to have like just one consultation just to check in to make sure like what they're experiencing is normative. We encourage them to come in and to utilize us. Because I don't think it ever hurts, I mean, especially when the bar is really low in that way, and to get someone to take a look and to talk through like what's going on. I mean, something that we certainly have seen over the time that I've been at Princeton and over the time that I've worked in college mental health is just increased rates of mental health issues among college students. That's been documented sort of nationally. It's increasing numbers of students who are suffering from mental health disorders, but also students who are reporting more severe mental health disorders. And so our utilization has increased every year. We've seen a larger and larger number of students who are coming into the counseling service. At this point, we see almost 27% of the student body in any given year. And I have to tell you, it's not just students who are, the worried well. It's students who are actually dealing with pretty significant issues. So, it's real. I think that there's been, Jean Twenge, who is one of the folks that is featured in the Manic Monologues sort of interviews, talks about it in her book iGen, right? She talks about this generation of young people and increased rates of mental health problems, and tries to sort of link that back to different things about this population. And one of the things that she talks about is social media, right? Which is one of the questions that you had earlier, and the impact of that on young people's sort of mental health and well-being. So, um, I agree with what Kimme and Whitney said. I think that, you know, if you notice significant changes, if there are severe sort of impacts on someone's functioning, those are all sort of red flags. I think it goes back to I always encourage people to sort of trust their guts about things. Like, your kid, and when this isn't like quote unquote normal, or this is just a mood, versus this is something that is feeling really off. And to trust your gut around that. I don't think there's any downside to just sort of like saying, you know what, just to be safe, like, I'd love for you to just talk to, you know um, to Dr. Ross, or or someone at Trinity, or something like that. I don't think it ever hurts.
Yeah, I'm curious what you said about, well, the fact that it's free and that there's a low, bar to entry, um, is so fantastic for college students, for any student, but certainly is so different than when I was in college, and I'm sure when you all were in college, because it felt like you were going to the place where like crazy people went if you went to the counseling services, and so it was embarrassing, or I didn't want to tell a friend or whatever. And I wonder if, Calvin, the students are really taking advantage of that, even at the check-in level, just like, I just want to talk, or is there still a level of like, I don't want my friends to know I'm doing this, or is it like a cool thing now to go see a therapist? Like, I'm just curious what it's like to be 20 and what the current language around it is.
Oh, it's a great question. I do think that, at least at Princeton, the conversations have been terrific around sort of mental health and acknowledging vulnerability, and trying to sort of take away the stigma from seeking out mental health treatment. But it still exists, and I think that it's um, platforms like the Manic Monologues that really go a long way towards increasing the level of conversation that people are having about mental health, um, challenging some of these sort of like negative stereotypes that people associate with mental health issues, so that we can all sort of decrease that stigma around mental illness. And that remains an issue that needs to be addressed, because there are still students, like, even though I think that the discourse around mental health is at a really great place right now at Princeton, there definitely are students who are very wary of like coming to McCosh Health Center because of what you just said, right? Like, there's students who would say exactly what it felt like for you when you were in college, right? Like that fear of like, I don't want people to see me. What are people going to say? What is my family going to think? I'm not crazy. That still happens as well. And so the more that we can have panels like this, conversations like this, um, that can really, save people's lives, 'cause it can
Yeah, I feel like, sorry.
treatment.
I'm so glad that was your dog and not mine, because it could. It's changing. As Calvin said, I mean, there's huge utilization rate there. My kids are at different colleges, and I would say it's probably the same, and it's a mixed bag. I think it's absolutely changing. At Trinity Counseling, it's been, I want to say hilarious, so I'll use that word. We've had kids from middle schoolers to high school students to college students bringing their friends with them like their friends just come with them to therapy because they're walking with them and they sit in the waiting room. And we've had those students ask if, as a result of just coming with them, hey, I've got some issues, I'd love to be in therapy too. So we've had referrals come that way just by people coming to therapy with them. So, there's a breaking down of the stigma that way. And then sort of at a national level, we have giants in the field. Like, can you hear that scratching? Sorry if that's bugging you. She's my dog scratching. We have giants in the field like Nobel laureates, Eric Kandel at Columbia, who's a neuroscientist, talking about psychotherapy is a biological treatment. We now have, through neuroimaging, psychotherapy changes brain chemistry. We know that. So as soon as the insurance companies will reimburse psychotherapy in a different way, that will also start changing the reimbursement rates and will give credibility to treatment in a different way. So sort of we're attacking it from all different dimensions. And again, the mindfulness and the mental health, the mentalization literature is part of common parlance also. So it's just the more we're talking about it and normalizing it as a treatment, the better it will be.
Yeah, and I wanted Kimme to ask you what the communities that you work with, whether, and I've been seeing also a lot of commercials lately of, sports stars and, famous figures talking about it. And that's been encouraging because it feels like men are talking about it more than they used to talk about it. And in general, and I'm curious about, the specific communities and communities of color and that you are, interfacing with.
Right. First of all, let me just say that I have a 12-year-old daughter. She's my oldest granddaughter. And she's been in therapy for a while because she was having some transition challenges moving from Trenton into the suburbs. And she was dealing with a lot of anxiety. And so happy that my daughter had the presence of mind to say, let me find a counselor that she can work with. And it's so normal for her now. It's like, well, Grammy, my therapist said, well, my therapist told me, So, and I get so tickled that that's normal for her, right? Because she recognizes this is a tool that's literally empowering her. But as you know, I founded the Urban Mental Health Alliance specifically to teach mental health and wellness and teach people how to advocate for themselves and their loved ones around their mental wellness, as well as recognizing a crisis, right? So, and looking in urban communities, and urban largely being communities of color and communities that are densely populated and impoverished, right? And that's whether you're Black or brown, immigrant or citizen. So one of the things that I'm finding is that the culture is shifting, right? There's stigmas around mental health in all communities across all races and ethnicities, but specifically in Black and Latino communities, right? There's cultural and historical and social reasons why there's stigmas around even saying the word mental health, much less a therapist. But that is definitely changing, right? And we have websites now called, Therapy for Black Girls and Therapy for Black Men. And, we have t-shirts that are talking about, Bible study, prayer, and therapy, and really beginning to normalize this conversation so that it's not about what's wrong with you if you sit in front of a therapist, but it's about what has happened to me or what I'm dealing with that I need to get in front of an impartial professional to help me unpack it, right? And so it really is beginning to change. And I'm so grateful for that. But we still, like Calvin said, have a lot of work to do to continue to not only normalize it, but also make sure we have an even playing field so that everybody can get the resources that they need. Because one of the things we struggled with when my nonprofit was operational was empowering people with information around how important it was to have therapy. And then we would have so many people that would come to us and say, okay, you've convinced me, now where do I get services? And we had to work really hard to get people plugged into different places. And then you wrestle also with the whole representation. If you're sitting in front of somebody who doesn't look like you and doesn't understand your culture, that can actually be more harmful than good, right? So how do we get people plugged in so that they feel like they're being heard and understood? And so the culture is shifting around mental health and around therapy, and that's such a good thing. But we've still got a lot of work to do to make sure that all of our communities have access to therapy, and we can start really normalizing that conversation the same way we go for, mammograms and dental checkups. And, we need to normalize that as well.
Exactly. It has to be part of the daily structure, the brushing the teeth, and I keep coming back to feeling hopeful that it will. I had a friend who told me that her daughter or her son came home from first grade and was talking about or maybe it was nursery school, talking about they have a class and it's called something. I don't know if it's called feelings or something, but they talk about their feelings and what happened today or something like that. Maybe it's a roundup at the end of the day, and maybe talk about what made them sad that day. And if that is starting in preschool or kindergarten, that is a really good thing.
I remember the very first time I heard my daughter say to my grandson, and he may have been about 4, and he was throwing a temper tantrum, and she said, "Use your words and tell me how you feel." And I remember thinking, where did she learn that? Because I didn't teach her that, And I was so grateful that, she learned that from what he was being taught in school. And so she was aligning that at home. And I thought, what a cool thing that my grandson is learning to express how he feels, because I don't know about you guys, but my generation was kids didn't have an opinion, And so I was so grateful that she was teaching him that, like what a healthy way to grow up and normalize the way you feel, right?
Totally. I'm going to say that to my husband tonight. I'm going to be like, use your words and tell me how you go.
I'm laughing because kids who grow up in the household where the psychologist is the mother, they say, yeah, I'm not talking about feelings anymore. So that's the other side of it. So
yeah,
I'm sure.
Exactly. Well, I wanted to get to something really practical that came up in the questions, which is, there are 2 questions, but I'm going to start with this one is, Calvin, it's great that students can access free therapy. How can one who's not a student, get free or low cost individual therapy that's at the same time good quality in this area? This person asked that lives in Princeton. And I'm just wondering if Kimme, you and Whitney can speak to that, and Calvin, you're welcome to as well. But
well, I'll definitely let Whitney speak because I think it is Trinity, right?
There are a number of organizations, and hopefully we'll be able to put it in the chat feature. There are a number of wonderful organizations. There are Jewish Family and Children's Services, AAMH, Oaks Integrated, Catholic Charities. I say Catholic Charities. Anyway, there are a number of wonderful organizations that do provide low-cost treatment, see Medicaid patients, et cetera. We do see patients with insurance, and we have a sliding scale, as does Jewish Family and Children's Services. You don't have to be Jewish to go there, nor do you have to be Catholic to go to Catholic Charities, et cetera. And we are doing everything we can to meet the needs of everyone who calls. The reality is that everyone is saturated, including every private practitioner I know in town. I've tried to place a number of full fee clients. I don't even know if they have out-of-network benefits recently, and people who are willing to pay literally any fee, and everyone is full today. And that is not unique to Princeton. It's not unique to our catchment area. It's really quite remarkable. And that speaks to the need of so many people who are looking for treatment today and support. So we've tried to be creative, and ways to handle that is to expand our social media presence, offer articles and resources, workshops, speaker series, doing things like this, sending people to Manic Monologues, et cetera, for resources. But the reality is it's really it's really tough. So we're continuing to try to figure out ways to increase funding so we can expand our resources. And that's the goal. And also help people understand that there are ways that people can access resources. And again, this biological based treatment and mindfulness and ways of calming our systems and doing things that one does do in therapy, the pause and the calming of the body and the natural endorphins and ways of targeting our sensory systems. And there are free resources, Tara Brock, Jack Cornfield, they're 1 minute, 5 minute meditations. There's things that you can pay for, Calm and Headspace also, but there are free resources online that are actually very good.
Yeah, even on our Manic Monologues site, which has a wellness section, which has links to all kinds of, they're both videos as well as books, but all the exercises. And Kimme, I don't know if you wanted to add to the overall question about accessing low cost or free resources, or whether Whitney covered that.
Right. In a lot of the communities that I work with, we do refer them to Catholic Charities and Oaks Integrated and a lot of other, smaller counseling centers. There's also a lot of clinicians in the communities that offer their services, they're private practices, but offer services either pro bono to a certain number of people, or for a very low fee, again, because they understand the need in the community and what the financial situations are in communities. And so a lot of times I'm able to plug people in there. But Whitney, touched on exactly what I was going to say, is that a large part of it is a lot of times is really just empowering people around how they can advocate for their own wellness, right? So exactly, learning things like meditation and mindfulness, but also getting the rest that you need, eating properly, making sure that you're exercising, removing yourself from stressful situations, making sure that you have a support network around you, getting plugged into activities that are going to bring you joy, and a whole host of other things that people can do to manage that, potential depression and anxiety that we're all kind of feeling on some levels, right? And so even if it means managing that while you're on a wait list, just the fact that you feel like you have some sense of control and are being proactive, that in of itself is a great help, right? And so a lot of the work that I do is around teaching people how to be proactive with their own self-care, as opposed to, well, I'm just going to sit here and fall apart because I can't, get in front of anybody professionally. Well, let's look at how we can manage that, as best we can while we're still trying to get you plugged in.
Yeah, I remember when I was very depressed in college and I was trying to, I thought like, I'm just going to shut down. And I remember somebody saying, you don't have to do it all at once. You can do one thing a day, just one thing a day that's going to be to make you feel good. Now, maybe it's working out, maybe it's calling a friend, maybe it's like, if we can think of these things in little chunks of, wellness and mindfulness. Calvin, I don't know if you had anything to add to that question, but.
No, I thought it was like, it's great. It's an education for me. And I just have to give a shout out to our people that are filling the chat. It's like Whitney says it and then it appears in the chat, like all the links. It's kind of crazy. Like I want that to walk around with me, right? Like I want to translate into web links, like whatever it is that I say. But if you haven't taken a look at the chat, all of the resources that Kimme and Whitney just sort of articulated, like in milliseconds, appeared in the chat with like information.
Right. And you can, and there is a little button where you can click on the chat and you can save it. So I cheat.
Really? I didn't know how to do that.
There is, and everything I do online, any training, presentation, panel, at the end, before I leave, I save the chat. And that's how I've been able to build my resource list. Wow. It's also how I'm able to stalk people. I look them up on LinkedIn and say, remember we were on this panel together? So
This is
save
great
the chat
networking
and
tool.
and then you'll have all the list of, everything that was in there.
Yeah, so if you go into your chat, there's 3 little buttons on the side and it'll say save chat. That's how you do it, right?
Yep, exactly.
Right, excellent. Well, we're rounding the corner to late dinner time, I think, for the panelists, certainly for my dog, and you're probably yours too, Whitney. But I wanted to just, I think I just want to say thank you to all of you so much, because this has been inspirational, educational, and really, I think the work and the important conversation that we all should be having and that we should encourage others to have. And so I want to thank all of you, and I want to thank Janie at the library for coming up with the idea of partnering with McCarter on this, and using the Manic Monologues. And I wanted to, Janie, do you want to say anything before I go to announcements and final words?
Yeah. Oh. Hi, everybody. I've been hanging out here in the background. So I'm Jeannie Herman. I am the manager of adult programming at the Princeton Public Library. And I have worked with McCarter for years and years. We have done a series, McCarter Live at the Library. And I think the things that I'm an extrovert, and it's one of the things I've really missed is being in our community room and working with our community partners like McCarter and the Arts Council and everybody else, and having these collaborative community experiences. And so when I went and I looked at the Manic Monologue site the first time, I spent probably an hour or two just like lost in it. And I thought there's a program here somewhere. And then it dawned on me that Mental Health Awareness Month was a great way for the library and the McCarter to rekindle their longstanding community partnership. And this has just been a dream panel and a dream event. Thank you, Debbie, for your great moderation, and Kimme and Calvin and Whitney, your insights were so great. And I'm going to add, I'm the parent of a senior in high school, and we've had to have a lot of conversations about, yeah, your senior year is not what you thought it was going to be, sitting in your room on a laptop. That's not what you dreamed it would be, but it's your story, and you need to, go forward from here and make the best of it. And, he's, and so on the offside, he's found himself being somewhat of a TikTok star in the meantime, because he's had all this extra time at home. He's gotten quite the following. And so I follow him on TikTok, and there's a whole lot of memes on TikTok right now about going back to the office. Everybody on TikTok is making fun of it. And the one that really hit me hard, I got my dog lying right next to me here, is people saying, I can't go back to the office. I'm my dog's emotional support human. My pet simply will not allow it. He's become my colleague, and it's so true. Our dog now gets very anxious every time we all 3 leave the house, whereas before that was his standard. He's had us home for 14 months. What's he going to do?
Oh, yes. I think we need to do another panel on pet therapy and what we're all going to do.
Actually, the library's looking at doing that. There's a cat therapist in Princeton, and we're going to have a panel with the cat therapist and how to understand your pet's anxiety. I haven't found the dog therapist yet, but I think my dog might need it because he's getting really anxious.
Oh, definitely.
That's I'm so glad you said that, because I have a cat who's very independent, but since I've been going back into the office more now, because I'm in the office now like 3 days a week, I notice when I come home, she's like a dog. Like, she literally is running in between my feet, and she will not stop meowing until I sit down and let her climb in my lap. And it occurred to me, she misses me. She's like really adjusting to me not being in the house. And even though for the last 14 months she's been pretty aloof, but all of a sudden it's like, oh, you miss me, and it never even occurred to me that would affect her, me going back to work. So that's a very valid point.
It's going to be a problem for me, because when I get home, it's like the biggest ego boost ever, because it's just like, I'm just the greatest thing since sliced bread. But anyway, we will get into pet.
Yeah, we won't get into our pet problems here, but this has been a wonderful, and I will say, I'll just put in here for those of you that weren't here at the start of the hour, the library, based upon the wonderful resources that McCarter put together, as well as some of our own recommendations, we do have a resource list based upon the Manic Monologues and some other books in our collection. And I will also say, the library, if there's a book that that you want at the Princeton Public Library, you just need to reach out, and we can get that for you, so we can connect you to the resources that you need. We're also there as a resource if you have questions or you need to find out a connection. We have all sorts of guides on our website to connect you to the community resources, whether that be for housing, food insecurity, mental health. That's what librarians do. We're there to help the community, and that's why I thought this event was really important. And we're also, we're looking at ways that we can, again, someone put in the chat right now, given the shortage of psychologists, people should consider organizing their own informal support groups. And even though they're not informal support groups, we do have things at the library, like, book groups where you can come and chat and feel connected again. And we're looking at the summer of having our book groups outside in the courtyard at the shopping center, so people can still feel safe and connect again and get used to getting out of the house once more. We're looking at partnering up with the YMCA to do a sampling of community fitness programs, because fitness is so important to your mental health. So, the library is really committed to the long-term health of our community in many ways, we're right there downtown. And Dr. Chin, you should encourage your students to come down the Witherspoon Street further. We feel like there's a force field at Small World Coffee that prevents the students from going further. But
They go to Olives. They go to Olives.
Yeah, Olives, maybe Olives. Yeah, a little bit further down.
Yeah.
But we do find that we do have some students that come there, and when they do, they often will approach the desk and say, "This is such a nice change from being on campus. It's so relaxing." And so sometimes that changes scenery for students who are feeling too caught up in campus life, that there is life beyond Nassau Street, beyond Olives and Small World.
Yeah.
And they should go further afield into town and find those spaces of peace and comfort for them.
Well, that's amen to that. And that is a great segue to 2 more things I want to tell you as we close. There is a really significant community event tomorrow night. McCarter is hosting another live virtual event called Healing Voices, Caregiver Stories. This is part of the 2021 New Jersey Theater Alliance Stages Festival. Professional and family caregivers, as well as patients receiving care, were asked to submit creative writing that reflects the theme of caregiving or the personal healing experience. And over 100 writers submitted pieces. 16 were chosen by McCarter. They've been woven together. And it's going to be an evening of professionally directed and acted virtual reading celebration that bears witness to the caregiving and healing experience. So this is a nice bookend to what we talked about tonight. The link to register for that is in the chat magically. And you'll also find that information on McCarter's website, where there's additional information on another community gathering event that will hopefully pull students to Calvin beyond Nassau or beyond the campus, that McCarter's giving free concerts on Sunday afternoons in Palmer Square through June 20th at 4 o'clock. People are bringing blankets, they're bringing libations, they're bringing, they're going to vendors and picking up some pizza and food and Small World Coffee, and we are having a range of bands, and it's been great so far, and it's really been nice to have live performance. And so you can find out that information on our websites from 4 to 6 on Sundays. So that's it. This was so wonderful, such a great way to spend a Thursday evening. I want to thank you all, and thank you all for participating and coming, those of you who were with us, and have a great night.
Thank you.
Thank you so much.
Thank you.
Thank you. Bye.